Cesarean section surgeries, or C-sections, to deliver babies are the most common surgical procedures in U.S. hospitals. Now, a new study of nearly 1 million births from 2008 to 2017 finds that Black women are almost 25% more likely than white women to have unnecessary C-sections, needlessly putting them at risk of surgical complications. The study's from the National Bureau of Economic Research and was done by 3 economists. Sarah Kliff is an investigative healthcare reporter for the New York Times. Sarah, in your story writing about this, you had a wonderful way of describing it. You had an example of, or a hypothetical, a Black mother and a white mother, same medical history, same doctor, same hospital.
Yeah, so they walk into the same hospital, they have the same doctor. On paper, their medical records look basically identical, but the Black woman has a 20% higher chance of delivering by C-section, which really begs the question, why is this happening?
Was there an answer to that in this study?
There's not one answer. There are some theories, and we can't exactly get inside the doctors' heads. It could be that they are aware that Black women have higher rates of maternal mortality, so they're thinking, I'm going to get this person into surgery faster. I don't want to risk complications. It could be that they aren't listening to Black mothers as much if they're pushing back against the idea of a C-section. It's difficult to tell, but we definitely know that something different is happening for these Black women.
And we should say that there are reasons why, medical reasons why a doctor would schedule a C-section, that the benefits outweigh the risks. But what are the risks of an unscheduled, an emergency C-section on a woman who has no complications?
Yeah, it's pretty much the risk of adding a major surgery onto the delivery. A C-section is a major abdominal surgery. There's the risk of an infection, of a hemorrhage. These are rare risks, but they are added on when you do a C-section. There is the increased recovery, which is happening when you have a newborn, which, as any parent knows, is a really challenging time already to have, a major surgery you're recovering from. There's also financial risk. C-sections are more expensive, so the patient could end up with higher bills from their delivery if that is how they end up delivering.
Now, the researchers looked for correlations. They couldn't find any correlations with medical risk factors, with the gender of the doctors, or the economic status of the mothers, but they did find one interesting correlation.
Yeah, the fascinating thing they were able to look at is what was going on in the rest of the hospital and if the operating room was empty. And I think this was probably the most interesting finding to me, was that when the operating room was empty, that's when Black women were significantly more likely to have C-sections than white women. When the hospital was busy, people are rushing around, but if someone really needs that C-section, Black and white women end up getting C-sections at near identical rates. It's when the hospital is less busy, when the OR is sitting there empty, that's really when you see these unnecessary C-sections happening on these Black mothers.
Knowing what you know about, from reporting covering this, how the hospitals work, the implication is they want to keep that operating room busy.
Look, most of the American healthcare system, it's paid on what we call a fee-for-service system. Every time you do an MRI, every time you do an operation, you are getting paid for that service. We weren't able to talk to the doctors or hospitals. This is an academic study. And I will say the rates of C-section are higher for both Black moms and white moms when the OR is empty, which suggests maybe conscious, maybe unconscious, but there is more of a propensity to send women to C-section when the capacity is there for them.
And Black women have long talked about different treatment in their pregnancies, a feeling like their doctors aren't listening to them, not taking their pain into consideration. Is this part of that?
Yeah, certainly. I've written some stories about patients who just feel like they weren't listened to, that they asked for an epidural and it took a long time to get it, that they said, I want to try natural labor longer, and they were really told, no, you need to go to a C-section. And I think it's, again, difficult to untangle the role of race in all of this, but it certainly is an experience of a lot of Black women that they feel like their providers aren't necessarily listening to what they want, and they might be listening better if their skin was another color.
Is there some thought or an indication that this could be a contributor to the fact that Black women have higher rates of maternal mortality and childhood infant mortality?
Certainly. C-section, again, is a procedure that's generally safe, but it comes with its risks. So if you're going to add on a major abdominal surgery, that's essentially increasing your risk for something to go wrong during childbirth. And, there are many stories out there you can hear of, Black women who tried to raise concerns during their delivery, they weren't listened to and ended up having a bad outcome. So that certainly could be a part of this story.
All these factors put together, the hospitals wanting to keep the ORs busy, Black women disproportionately being sent there. What does this say or suggest about the state of healthcare in America right now?
It suggests that a lot of the things that determine the healthcare you get, they aren't about your medical records. They aren't about what you actually need. They're about all these other factors, the color of your skin, whether the operating room is available if it's sitting empty, that the healthcare that we're all receiving, it's not just about what we need, but all these other factors that are completely out of our control are contributing to the care that we get.
Sarah Cliff of the New York Times, thank you very much.
Thank you.